Let's change the course of non-communicable diseases. GSCF unveils the Self-Care Manifesto. The numbers are alarming. Non-communicable diseases, NCDs, such as heart disease, cancer, and diabetes, account for a staggering 75% of deaths worldwide that are not linked to pandemics. This issue isn't limited to wealthy nations. In fact, it is predominantly a crisis striking low and middle-income countries, where 85% of premature deaths from NCDs occur. Queerly, traditional healthcare methods are inadequate for addressing this pressing situation. What we truly need is a fresh perspective, one that empowers individuals and reinforces health systems from the grassroots. This is where the concept of self-care comes into play, and it is now rightfully taking center stage in discussions about global health. The World Health Organization, WHO, defines self-care as the capability of individuals, families, and communities to foster health, prevent illness, and effectively manage health conditions. It may seem straightforward, but it's a transformative idea designed to equip individuals with the resources necessary to take charge of their health, be it through managing chronic illnesses, getting vaccinated, or utilizing digital health platforms to track vital signs like blood pressure. A more intelligent approach to health. At first glance, self-care might appear to be solely an individual burden. However, it represents a potent public health strategy that creates positive effects throughout entire communities. The Self-Care Manifesto, introduced by the United for Self-Care Coalition during the recent United Nations General Assembly, embodies this very premise. This initiative aligns with the upcoming 2025 UN Political Declaration on NCDs and insists that by investing in self-care, we can achieve a more accessible, efficient, and equitable healthcare system. Imagine the profound implications of this approach. Initiatives focused on self-care have the potential to help an additional 150 million individuals manage their hypertension and assist another 150 million in quitting tobacco. The statistics highlight not just the preservation of lives, but also the alleviation of pressure on healthcare systems that often feel overwhelmed. By empowering individuals to take charge of their everyday healthcare needs, we can liberate medical professionals to concentrate on more urgent cases. This is not merely about circumventing healthcare systems. Rather, it's about fortifying them. Moreover, the financial benefits are nothing short of remarkable. We are talking about potential savings measured in billions of dollars annually. By 2030, implementing self-care measures could create an astonishing $179 billion in healthcare savings and liberate 2.8 billion physician hours each year. In low and middle income countries, this could translate into an impressive $230 billion in potential economic gains, leading to a revolutionary shift in the healthcare landscape. Our call to action. It's vital to clarify that self-care should not stand in for professional medical assistance. Instead, it acts as a crucial partner. The goal is to cultivate a health ecosystem that equips individuals with the know-how and tools necessary to promote their well-being, while allowing healthcare providers to utilize their specialized skills more effectively. The manifesto urges policymakers and member states to transform this vision into reality through several key actions. Commit to investing in self-care infrastructure, which includes digital health resources, educational initiatives, and equitable access to self-care products and services, with a focus on ensuring support for women, youth, marginalized communities, and other vulnerable populations. Encourage self-care through financial models, such as by implementing value-based care systems, universal coverage frameworks, and collaborative efforts between public and private sectors. Incorporate self-care into workforce planning, enabling healthcare teams to direct their expertise where it is most needed, while empowering individuals to manage day-to-day healthcare tasks. Embed self-care into primary care frameworks, facilitating earlier intervention, improved health outcomes, and reduced strain on existing systems. actively include patients and individuals with real-life experiences in the development, execution, and evaluation of self-care policies, resources, and tools. The solutions are within reach and entirely implementable. Now is the moment to adopt a new approach to global health, one that empowers each of us in the collective battle against NCDs. The United for Self-Care Coalition is a worldwide assembly of like-minded entities committed to a shared aim, achieving universal health coverage by integrating self-care as a vital element of the health continuum, particularly in the management of NCDs. Combat the misinformation epidemic in health knowledge and support accurate health policy reporting from the Global South. Our expanding network of journalists located in Africa, Asia, Geneva, and New York highlights the connections between local realities and major global discussions, offering evidence-based, accessible news and analysis. To make a personal or organizational contribution, please click here on PayPal.